Welcome to Nexus Medical Media. In this video, we are going to talk about a general classification of antipsychotics. But before we talk about the different classes, let's start by defining psychosis. Psychosis is defined as detachment from a reality in thought or action, and this is a symptom, not a diagnosis, because psychosis can occur in different conditions. Psychosis is characterized by hallucinations, delusions, disorganized speech or thoughts, disorganized behavior, and negative symptoms like apathy, withdrawal, avolition, etc. Now, antipsychotics are drugs used to treat psychotic conditions such as schizophrenia and other agitated states. They are also used in treatment of severe nausea and vomiting. Right, so this is what you need to understand first, a dopaminergic pathway. There are different theories to why psychosis occurs, but in this case, let's talk about the dopaminergic pathways. Right, so as you can see here, you have mesocortical pathway, a mesolimbic pathway, nigrostriatal, and tuberoinfundibular pathways. Right, so first you need to understand the different kinds of symptoms, right? So there are positive symptoms and negative symptoms. Positive symptoms are those symptoms which you get, right? So they are not normally there, but you get them. For example, hallucinations, delusion, right? Another group is called negative symptoms, right? So in negative symptoms, you are losing something, right? So you are withdrawing from the society, like as withdrawal or apathy or avolition, right? So those are negative symptoms, right? So back to the different pathway, right? So firstly, you have the mesocortical tract or mesocortical pathway, right? So in this case, that's where negative symptoms and cognitive symptoms come from, right? Because in this case, there is a reduced activity of dopamine, right? There is too little dopamine. Next is the mesolimbic pathway, right? So in mesolimbic pathway, that's where positive symptoms come from, and this is due to increased dopamine, right? So if you treat a person with antipsychotics, right? So in this pathway, there will be antipsychotic efficacy. Antipsychotic efficacy. Next is the nigrostriatal pathway, right? So dopamine normally suppresses the activity of acetylcholine, right? But in this case, there is low dopamine in this pathway. It means there will be inadequate inhibition of acetylcholine. And what will happen if you treat with antipsychotic is that there will be extrapyramidal symptoms like acute dystonia, ataxia, akathisia, and thus Parkinsonism in general, right? And the next pathway is the tuberoinfundibular, right? So you have a dopamine, right? So dopamine normally inhibits the release of prolactin, right? So if you treat with antipsychotics, you are reducing the concentration of dopamine in this pathway. It means there is no inhibition. So there will be hyperprolactinemia. Right. So now we have talked about these different pathways. Let's look at the drugs. Antipsychotics are divided into two main groups: typical or first generation antipsychotics and atypical or second generation antipsychotics. Right, the typical antipsychotics are further divided into three groups: phenothiazine derivatives, thioxanthine derivatives, and butyrphenon derivatives. Right, so under thioxanthine, you have one drug called thiothiazine, and under butyrphenon, you have haldol or haloperidol. Right, so phenothiazine derivatives are further classified into three main groups again. You have the drugs with aliphatic chain, aliphatic derivatives, and in this case is chlorpromazine. Piperidine derivatives are, this drug is called thioridazine, and piperazine, right? So you need to understand piperidine and piperazine. Piperazine, you have flufenazine, triflufenazine, and pefenazine, right? So between first generation and second generation, you have another group, right? So in this group in the middle is saupiride and saupiride and saupiride, right? Looking at the first generation antipsychotics, again, they are divided according to potency, right? So they are high potence antipsychotics and low potence antipsychotics. The high potence are haloperidol, flufenazine, triflufenazine, pefenazine, pimozid, right? So these are high potence, and the low potence you have chlorpromazine, thyroidazine, right? So thyroidazine is no longer used, right, because of retinal deposition, like the main side effect, right? So high potence are more likely to cause extrapyramidal symptoms and less anticholinergic activity, while the low potence are less likely to cause extrapyramidal symptoms but more anticholinergic and anti-alpha activity, right? So the first generation antipsychotics mainly act by blocking the D2 dopamine receptors, like, so they have D2 antagonism. The next group is atypical, right? So the atypical antipsychotics, the mother of all is clozapine, right? So other drugs you get there are olanzapine, quetiapine, aripiprazole, ziprasidone, risperidone, paliperidone, and many more, right? So these drugs, the second generation, they mainly inhibit D2 and 5-HT2A, right? So it's serotonin, right? So second generation antipsychotics are more likely to cause metabolic syndrome, right? Okay, now let's just have a general review, and we'll talk about these drugs in upcoming videos, right? So this is just a summary of everything that I just talked about, right? So the first generation are also called typical antipsychotics. They mainly block D2 receptors, and the examples are haloperidol, chlorpromazine. They are more likely to cause extrapyramidal symptoms like dystonia, akathisia, pseudoparkinsonism, and tardive dyskinesia. Metabolic abnormalities, right? So first generation are less likely to have metabolic abnormalities. Looking at the second generation antipsychotics, right? So these are also called atypical antipsychotics, and they primarily block D2 and 5-HT2A receptors, right? The examples are aripiprazole, olanzapine, quetiapine, risperidone, clozapine. These drugs are less likely to cause extrapyramidal symptoms and tardive dyskinesia, but this can occur, right? But it's less likely. Second generation antipsychotics are more likely to cause metabolic abnormalities like elevated glucose, lipids, and weight gain. Right, so this is just a basic introduction. In the upcoming videos, we'll talk about atypical antipsychotics in a separate video, talking about them one by one, and we'll talk about the atypical, including their side effects in great detail. So I hope you got the basic understanding and classification of these antipsychotics. If this video is helpful, please make sure you click the thumbs up and subscribe so that you won't miss any of my latest videos. Thank you so much.